Now, while most of us may have come to our interest in cannabis because a pet parent brought us a cannabis product and said, please help, or because we're beginning to read some of the literature that's coming out on the human side as well as the animal side, or because we've had an intersection with cannabis ourselves in a family, friend, self, for some reason, our interest has been piqued in cannabis and cannabis-derived molecules. However, from a practitioner perspective, it is impossible to learn about cannabis medicine without first understanding the system that allows these cannabis-derived molecules to have an effect on our patients. So we're going to lay some groundwork and talk first about the ECS, or this endocannabinoid system that is within all of our patients. This endocannabinoid system is a system for balance. It is a system that is going to allow a lot of intracellular communication and, importantly, intersystem communication. So this ECS is responsible for balancing and regulating all of these subsystems, cardiovascular, musculoskeletal, a GI tract, and because it has fingers into or regulation ability within all of these other systems, that's really the mechanism by which we begin to see the endocannabinoid system provide homeostasis to the body. If the ECS is out of regulation, that animal's body is not going to be balanced. It's not going to be in a homeostatic state. So when you're thinking about patients, beginning to think about cannabis implementation in some of your cases, making sure that you have a picture or an idea of the ECS and how your patient's ECS or balancing system may be out of whack is really the first step to thinking about what you want to do to fix it from a cannabis perspective. There are actually a lot of modalities that affect the ECS. Cannabis is just one of them. So from pharmaceuticals, probiotics, herbal remedies that are not cannabis, other herbal remedies besides cannabis, acupuncture, exercise, diet and weight change, even to chronic stress. There are so many things in our patient's world that are going to affect their endocannabinoid system, things that we as practitioners should absolutely keep in mind. Now, interestingly, and I just find fascinating, on the human side, there is actually a clinical endocannabinoid deficiency syndrome. This syndrome has been linked to chronic GI disease in humans, anxiety disorders in humans, seizure disorders in humans. And so while we don't have a specifically identified deficiency syndrome in animals, as a veterinary practitioner, I think we would be remiss if we didn't at least begin thinking about what implications might this have in our veterinary patients. Could this be a syndrome that our veterinary patients experience? And what does that look like? How can we think about as practitioners to increase the health and well-being of our patients?